Coming up next on Being Well, pharmacist Mike Craig from Sarah Bush Lincoln Health System will be here to talk about prescription medications. We'll address common concerns that you probably have, such as side effects, interactions, and what to do if you think your meds are not working for you. Mike will provide us some great advice we can all use. That's just ahead, so don't go away. Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Dr. Ruben Boyajian, located at 904 Medical Park Drive in Effingham, specializing in breast care, surgical oncology, as well as general and laparoscopic surgery. More information online or at 347-2255. Rediscover Paris. Our patient care and investments in medical technology show our ongoing commitment to the communities of East Central Illinois. Paris Community Hospital Family Medical Center. Welcome back to Being Well, and today Mike Craig is with me. You're the Director of Pharmacy for Sarah Bush. Thanks for coming on the show.
Well, thanks for having me.
For the first time.
Yes.
So when people find out you're a pharmacist, what's the most common question they like to ask you?
A lot of times they'll start running down their list of drugs that they're on and ask me questions, or maybe they're elderly parents, so they'll start asking me questions about some of the meds that they were started on.
So at some point in our lives, we're all probably going to take some kind of prescription medication. And a common question that people have asked when they found out we were doing this show is, what's the difference between a generic, other than price, generic and the name brand?
Okay, so a name brand is a medication that first made it to market. So the company did the research, they did the studies on that. They went through all the FDA process, and sometimes that takes years to get through that. And so they make it and they do all the studies, and they have 12 years after they patent the drug to sell it exclusively. And so that's why they're a little bit higher, because they paid for all the research, whereas the generic drug companies can come right behind them and copy the chemical. Now those have to be tested by the FDA as well, but there's a lot less testing as far as efficacy or how well they work, as opposed to are they equal? And so that's what a generic drug is essentially a second company coming in behind you. So for example, it would be like the cane sugar, that you might think of, that a certain brand, and then somebody else comes in and starts growing cane sugar and selling it as well. So essentially it's the same drug. The only circumstance where I would caution people about it to consider to talk to their doctor or the pharmacist are drugs where the levels are important and where they draw drug levels and they check these things routinely. Your physician may want you on a particular one and not to be changing from brand to brand.
Okay, that's what I was going to ask. Who decides whether you're taking the name brand or the generic?
Typically the physician will say if they want you on the brand name, and if not, the pharmacist will probably find you a comparable generic from a good manufacturer that they carry and automatically switch you over, which most people want because, as everybody knows, they're a lot less expensive.
Yeah. So what makes some prescription medications so much more expensive than others? Is it the research that goes into it, or how much is available?
There's a lot that really goes into that. Sometimes it's the research, sometimes it's the risk. So for example, if you had a drug that treats blood clots, and by thinning the blood, there's a greater danger, and we've all seen the ads of, thebaddrug.com, and these type of things would scare people. So those actually would factor into the fact that it's a higher risk and maybe a higher technology. Also, if it's a brand new medication that treats things that haven't happened before, and it's unique that way, it takes a little longer to get through the FDA, and you have to do more research, so therefore there are a little more costs associated with that.
Well, we're going to talk today about kind of big classes of drugs that a lot of Americans are on, and we want to start with the high cholesterol, the statins.
Yes.
Talk a little bit about statins and what they do, and maybe why they have a few more side effects than some of the others.
Okay, first I'd like to start with statins They get a bad rap. They do have known side effects. They can cause muscle problems and different things, but they work well. And for a lot of people, there have been a lot of studies and a lot of research that show that if you keep your cholesterol within a certain range, that you'll actually extend your life. And so it's kind of one of those give and take situations. Some people tolerate them better than others. But again, there's always lifestyle modifications and some other things that you could use as well to help manage your cholesterol. But yeah, the statins are one that I think because they're so prevalent, so many people take them, and there are a known set of side effects and things that again, I think that people, there's a lot of perhaps uneducated information out there about the statins and the use of the statins.
So if you get put on one and you're having all these side effects, how long should you put up with those side effects, or how long maybe does it take for your body to maybe get used to before you should march into your doctor and say, I don't want to be on this?
Well, one thing I would say first off is that's a good conversation to have when you start the medication.
Okay.
And kind of establish that, ask that question while you're in the physician office, or perhaps even when you reach your pharmacy, ask your pharmacist that question so you feel more comfortable with making that call. And it's something that you're a little more educated on. So typically it varies with everybody. Everybody is so different and reacts so differently, but it depends on your tolerance. And sometimes just knowing the fact that when you go home that you may see these things, and what's the difference between a side effect that I could anticipate and that my body will adapt to versus one that, hey, this is a problem and I need to call my doctor right away to address this. So with the statins, I would say it's more of a matter of how well you tolerate and you know, how severe are your side effects.
Are some of those maybe side effects that will sort of dissipate after a while?
Yes,
okay.
Some could be. Yes, yes, some could be, and there's a variation. There's a lot of different drugs within that class, and there's different reactions to different drugs, and there's different ones that your physician can try. If you try one, it's working well, but you're not tolerating it well, typically your physician can switch you to something different.
Else.
Yeah.
Well, we take medications for high cholesterol. High blood pressure is another one. A lot of side effects with things like that? Typically not.
Okay. Not as much. Mostly what you see is the fact that you're lowering your blood pressure, so your body's going to feel a little different initially. You may feel a little more tired. You know, some of them, such as beta blockers, for example, is a common one that people are aware of that suppresses your adrenaline's effect on the body, essentially. So you're going to kind of feel that at first, but typically your body will adjust. And you can keep your blood pressure under control without the side effects. But again, if that continues and persists, then people should definitely check with their physicians if they're feeling lightheaded, dizzy, often those type of things. Those would be triggers for me to call my physician and say, hey, you know, I need to come back in and see you about this, and maybe we need to adjust that.
So maybe you're having these issues and you can't get into the doctor. Do a lot of people forget that they could talk to the pharmacist?
Some people do. A lot of people talk to us, though.
Okay.
I mean, we get a lot of calls and people talking to us and asking those type of questions. But I think that's better, you know, as opposed to somebody just stopping their medication without notifying anybody. I think it's good to call the pharmacist if you can't get to your physician right away and just say, I'm having these side effects, you know, what can I do? Because a lot of times, you know, stopping a medication abruptly can cause more trouble than you may be having otherwise.
Yeah, let's get a little more into that, because it can be frustrating. You're taking different medications and you feel terrible, and you say, you know what, I'm going to get rid of it all. I'm not going to take any of it. What is the danger in that?
Well, it depends on what you're treating, but a lot of times, for example, let's talk about blood pressure, or let's talk about a blood thinner. Either one of those, and even some of the meds for anxiety and depression and those type of things, that you have a rebound effect, and the symptoms that you were having that got you on the drug initially, you can actually, those can become worse by
if you just
discontinuing the medication abruptly. The other thing that I would caution people about is discontinuing medications because they feel better. So, and that's not uncommon as well, is that people think, well, you know, I feel better, my blood pressure's fine, you know, I'm not having this effect anymore. Well, a lot of times that's a sign that the medication is working. Right. And if we discontinue that without checking, then sometimes again we go right back into the initial problems. So
let's talk about another classification of drugs, and that's antibiotics. When you said people feel better, they quit taking them, that's probably a common area. Talk to us a little bit about antibiotics.
Okay, antibiotics are kind of controversial as well on a couple of fronts. Sometimes we have to be careful of what we call treating the parents with children, because the kid comes into the doctor, and the doctors are more cautious perhaps than they used to be with using antibiotics, because widespread use of antibiotics can lead to resistant bacteria. And so for a child who might have a viral infection, if you put them on an antibiotic and expose them, well, you're increasing their risk later of maybe having an infection that's going to be more difficult to treat. So doctors are a little more cautious and conservative, I think, today in using the antibiotics. So if you are put on an antibiotic, there's probably a pretty good chance that you need to be on it. And so the second part of that would be that you need to continue that course of therapy until it's finished. And again, a lot of times it'll suppress the bacteria, but you want to eradicate it completely. And if you stop somewhere along the lines of it being gone, then it could come back. And if it does come back, then there are greater chances that it might be a resistant bacteria.
And you'll need something stronger.
Correct,
Okay.
yeah, and more expensive.
And why do antibiotics for some people cause nausea and just that?
It's just simply, those are easily managed side effects. Those are not ones that we worry too much about. Those are typically one you could probably talk to your pharmacist about if you're having problems with an antibiotic like that, kind of a tolerance. Just sometimes, just based on their chemical nature, that they're just irritating to the stomach lining. And sometimes they can disrupt what we call the normal flora of the bowel, and they can cause different things like diarrhea or constipation, depending on those type of things. So those are things that you could speak with your doctor about, or oftentimes you could talk to your pharmacist, and they can help you manage those side effects, because typically you're not on an antibiotic but for 5 to 10 days, something in that range.
Let's talk a little bit about pain medication. That's something that, maybe we had a dental procedure, an injury, and we get this pain meds. There's some side effects and actually, some dangers that can come along with pain meds.
Sure. I'd probably start with the fact that pain meds have kind of a bad stigma in our society today due to abuse and different things and dependency concerns. But I would tell people that typically if they're treating a procedure or a short-term pain situation, that those aren't really concerns as far as dependency. And we actually encourage people to use them as directed, especially the first day or two, until they kind of understand how much pain they're going to have, and then wean themselves off, as opposed to the approach that a lot of people take is that they're very conservative and concerned about different side effects and dependence things, and they actually wait till their pain becomes too great, and then it's hard for them to manage it well. Right, so it's really better to start out taking it as directed and then kind of weaning yourself off, as opposed to the opposite tack. So typically we don't see a lot of short-term side effects with pain medicines, other than the ones you would expect. I mean, it's going to make you feel funny. It's going to make you feel tired. Sometimes it can upset your stomach a little bit. That's not an allergic reaction. That's something that we would anticipate that would happen in a lot of people. Occasionally, especially in the elderly, there may be some constipation, and people can take a stool softener or some Metamucil or something to that effect while they're taking it to kind of help manage those things. But pain meds are very important, and especially in surgery and those type of things. And if you manage that pain well, then it helps your recovery typically. Now, long-term management of pain is a whole different ball game, and there's that becomes a little more tricky, because then you're getting into some of the heavier drugs, the OxyContin, the Duragesic patches, and those type of things. And there are probably more long-term side effects that you would look to manage, some of the constipation and those type of things, and you really need to work with your physician well, and the physicians typically will use multiple drugs that are non-narcotic also to try to address those, so they're not just using high doses of narcotics on patients.
You had mentioned briefly about an allergic reaction. What if someone's having an allergic reaction to a medication, what form does that generally take, or it probably depends?
A little bit. Typically it's hives. So
Okay.
a skin reaction would be a classic allergic reaction. Also, there would be sometimes a tightening in the throat, those type of things. Those are probably the more alarming and more concerning type of allergic reaction that you would have, that you would probably want to get a hold of your physician right away. Typically, they can use some Benadryl, and then if it goes beyond that, they can use some epinephrine to kind of help alleviate those side effects. But if you do have like hives or that tightness in the throat, those type of things. Those are things that are serious and that you need to make sure that your physician is aware also, so they can put that on your record for future reference. And you should put that on your drug list, that you had a reaction to a particular drug.
Okay. This is a question from a viewer who had a stent put in, had some heart issues, and comes out of the hospital. You don't feel good because you've had heart issues, and you're on a whole bunch of medication. And her question is how do you figure out what's causing some of these adverse side effects? Is it the procedure? She was kind of baffled as to, I don't really know where to start to start by self-diagnosing this problem. What advice would you give?
Well, it's a great question, and it's a complicated answer. But it's one of those that, again, I think that it starts with the physician at the time of the treatment, and then the medications, that when she started on those. I think that's a conversation, and most physicians are really good about sitting with the patient and talking to them and asking those questions. But if it is your right to ask that very question, what can I anticipate? I guess I would advise people to say, ask the physician, which side effects can I anticipate, and which ones, if I have, that I need to call you right away. And then that kind of gives you a little more peace of mind. But again, you're coming out of a procedure that in and of itself is disrupts your body, and you have some healing going on, and you're probably not going to feel well necessarily. And there may be dyes that they used during the procedure that can cause you to feel that way. And again, when you start on a medication, your body needs to adjust to that medication. So you're putting a chemical into your body that's affecting the way your body functions, and the way our body works. We just have to adapt to that and adjust. So I think it's just education and asking the questions, and asking the physician and asking the pharmacist, and being proactive about that, and not waiting too long to ask the right people the right questions, and perhaps making sure that your resources are good resources, and not your somebody who knew somebody who took a drug and had a problem, that type of thing.
Yeah,
so
because as you said before, everybody is different and how we are affected by medications. That's probably why there's so many side effects listed.
Oh, absolutely.
One or two people maybe have had those.
Right. And if you ever read what we call the package insert on a medication, you'd probably never take any medications.
No,
because
you wouldn't.
the list of potential adverse reactions is huge with anything.
What about advice you'd have for maybe someone who's caring for an elderly parent? And we know as we get older, we're taking more and more medications. How can we help our parents or loved ones sort of manage their medications so they're not taking too much of one thing, that they're taking things when they should?
I think there are several answers to that question as well. One would be to become involved. If your parent is concerned and needs a lot of your help, then you probably need to be in that conversation when they're at the doctor, and having those conversations as well. So you're educated as far as why are they taking things. And again, I get a lot of calls at home personally about that. Hey, my mother was started on this, and what should we anticipate? But the other thing I would say is the weekly planner. Is a really good tool for the elderly, because compliance is so important that they take their medications as directed, so they'll work effectively. So there's nice weekly planners, and if you can sit with your parent and just divide those out and kind of have that conversation with them once a week, and at the end of the week you can actually look at the planner and see if they are taking their medication as on schedule, or if they're missing doses, that type of thing.
Can you talk about the importance that some medications need to be taken at certain times of the day, or with or without food?
Right, and that's that would be a good conversation for the pharmacist, and a lot of times they'll put little tags and things on the prescription vials, which you should look for those type of things. Generally speaking, there are a few drugs that we like for people to take at certain times of the day, but typically we just like them to take them routinely, whether that be once a day. Sometimes it's easier for people to remember in the morning, sometimes with the evening meal. A lot of times it doesn't matter. There are certain drugs for diabetes and different medications that they actually work better given at certain times. So if it says twice a day after meals, then you should take that twice a day, usually breakfast and dinner after meals, and that type of thing. But if it's a medication, for example, for heartburn that you take once a day, you may find it works better for you if you take it in the morning, but typically it's okay, whatever works best for you. But again, that's a conversation that you could easily have with the pharmacist when they're dispensing the medication.
Let's talk about how keeping our own personal medication record, but how do hospitals or healthcare providers keep track of what we are on? I mean, if you go to the Sarah Bush Lincoln system, I would assume your records follow you. But how does it work? Say if I go to the doctor here, but I go, on vacation, get hurt, is that hospital going to know what I'm on?
Not currently.
Okay.
That is something that's in progress, and it's part of an initiative, a national initiative that our current administration actually put in place to have good communication and have that follow you electronically, but it isn't that way currently.
Okay.
So it's really kind of important for the person who has the illness or has the medications to keep a very accurate current list with them. We rely on that heavily. When they come into the hospital, we can't treat you effectively if we don't know what you're taking. And a lot of times, unfortunately, people will get a nice list and they'll put it in their wallet and then they'll forget about it. Well, then when they come to the hospital and we start talking to them, then they'll say, well, I stopped taking that several months ago because I couldn't tolerate it. Well, essentially we're getting a mixed message, because when you hand that list to the providers, you come in, you're telling the provider that you're taking that medication. So it's really important that they keep that current list and keep it accurate. Within the area, typically, if you're going to a walk-in clinic or a physician's office that's owned by Sarah Bush and then you come to the hospital, that information does follow you. And although it's always good to have that conversation, because you may have stopped taking something on your own.
And that is probably why when they do ask you, and I think as the patient, I'm sometimes thinking, well, don't you know that already?
Right.
But they do often ask you the same thing. What medications are you on? Are you allergic?
Right, and it's so important because, again, people adjust their medications on their own without their physician's knowledge. And if you come in and you have high blood pressure and, unbeknownst to your physician, you stopped taking your blood pressure medicine 2 weeks ago, that's an entire different ballgame than a person who's taking their medication as directed and has high blood pressure. It's basically changes everything. So that's important. And also, if you were to go see somebody in Springfield or somewhere else and come back on a new medication, we may not be aware of that.
Okay, that's what I was going to ask. If you say you did go to another hospital, they don't always know that. So when you go back to your regular doctor, you probably should say, hey, I'm now on this as well.
In a perfect world, there's good communication between those offices and physicians and things like that. But we can't always rely on that. And sometimes the physicians rely on the patients to relay that information as well. In the hospital, we have an electronic way, once we're treating you, that we can actually go out and we can see some of the things that you've had filled if you're a patient there, so we can better manage your therapy.
But the important thing is you need to be your own healthcare advocate and keep
Absolutely.
track of
You have to keep that list, and we have nice little pocket cards that we hand out to people frequently, and we try to get out to health fairs and those type of things and give those away. But it's not only important to have one, but it's important to maintain it and keep it up to date.
Well, and you don't know, you may be in the ER and unable to communicate or even remember what you're all on.
Right. And you asked earlier about what could we do for our parents, and I think that would be an important thing, is to help them maintain that list and make sure that they have that list. Because when a person comes into the hospital or into the emergency room, a lot of times there's a lot going on with them, and they're upset, they're scared, there's a lot going on, and they don't always remember at that point. Even though sitting here right now, we might know exactly what we're taking and we could list that out and the strengths and everything. If you get in that stressful situation, you just may get confused and forget completely what you're taking.
My last question, Mike, is what should we do with medications that we know are no longer taking or expired? Should we tend to want to hold on to them just in case.
Right.
I actually did go through my cupboard and got rid of some pain medications. It was hard to get rid of it. Even though I wasn't going to take it ever again. But
Right. Well, it depends on what it is. There are certain medicines that you take as you need them, and typically what I tell people is that those are probably good for a year once they're dispensed. And if it's something that your doctor's aware that you may use it when you need it, if it's for allergies or something like that, you can typically keep that. If it's something that you've stopped taking because your physician advised you to, or you weren't able to tolerate it, then it's good to get rid of that and just get it away so you don't take it anymore. And you can actually, what I advise people to do, there's several ways to get rid of medications, but we can usually put them in the normal trash, because the trash goes into landfill, and the landfill is supposed to protect the water system. So as long as you render them where somebody can't use them, like if you put them in a liquid or something to that effect, and put them in a bleach bottle or something to that effect. You can return them to some pharmacies. And we actually, at Prairie Medical Pharmacy at the hospital, have a return system where we can, it actually gets taken back to Pontiac, Illinois, and incinerated there. So it's not always a good idea to flush things down the toilet because that puts it right into the water system. And strangely enough, some things that you wouldn't think would be dangerous, like the estrogens and birth control pills and things like that, those are the things that exist in the water through the treatment systems and things like that. So unless it's a narcotic or something like that that you just really need to destroy, typically we tell people either to render them where they can't be taken by somebody else, because there are situations where people have gone through trash and things like that to pull things out. So that's what I recommend for people to do.
All right. Well, Mike, we're all out of time. Thank you so much for coming by and giving us some great advice. It's something that will touch us all at some point, if it hasn't already, in how to take medications effectively and safely.
Okay, I appreciate the opportunity.
Thanks.
Thank you.
Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Dr. Ruben Boyajian, located at 904 Medical Park Drive in Effingham, specializing in breast care, surgical oncology, as well as general and laparoscopic surgery. More information online or at 347-2255.
Rediscover Paris.
Our patient care and investments in medical technology show our ongoing commitment to the communities of East Central Illinois. Paris Community Hospital Family Medical Center.